All patients, whether receiving oxygen or not, may be vulnerable to airway obstruction or complications. A vital skill for CFR advanced practitioners is therefore to be able to provide suction. Suction is the name given to the process of aspirating fluids and debris from the airway by use of a vacuum. Just like oxygen, there are a number of ways of providing this vacuum, which will be dictated by your own circumstance. There are three main types. 1. A wall-mounted vacuum line where negative pressure is generated centrally, usually in an acute hospital setting. 2. Portable electric suction devices, which are battery or mains powered and generate their own vacuum. 3. Hand units, which rely on squeezing a trigger and series of non-return valves to generate a vacuum. FEC approves the use of all three suction or vacuum delivery systems. You will now have 1 minute for your instructor to walk you through the suction delivery system most suitable for your workplace. The suction line requires connection to a tube or catheter before insertion into the patient's airway. In preparation for this intervention, the CFR must first select the most appropriate catheter type. 1. A rigid or Yanker catheter, suitable for general use, or a soft tip catheter, usually reserved for more delicate interventions. In either case, the catheter must first be measured by placing it along the patient's jawline with tip resting on the corner of the mouth. The measurement is taken at the angle of the jaw. CFR providers must never advance the catheter further than the measured length. Catheters often have a vent hole, which allows suction to be applied once the hole is occluded. The catheter should be inserted in the suction off mode and only switched on as the catheter is withdrawn in a spiraling action. Prolonged periods of suctioning, that is greater than 10 seconds, should be avoided.